Hi, I'm Dr. Jon Wilhelm with Pro Chiropractic in Bozeman, Montana, and today we're shooting a video and talking to you about shockwave therapy for plantar fasciitis. Let's first talk about what shockwave therapy is. So shockwave therapy, also known as pulse wave or pressure wave therapy, has this compressor unit that sends compressed air into this handpiece. Now inside of this handpiece is a little metal rod. And that metal rod, inside of it, has a little metal bullet. That metal bullet travels up and down through that metal rod and then hits against a transmitter head. Now, the transmitter head just screws on, just like that. And as you can imagine, as that metal bullet strikes against it, it produces pulsing waves or shock waves that then can penetrate into the tissue and create change in that tissue. A number of wonderful things happen when that takes place, and we'll leave some of those in the comments section. Now, this handpiece itself is designed to be able to control two things. One is how fast that metal bullet goes up and down and hits that transmitter head, and how hard it hits against that. So if I turn this on, you can hear that if I turn it up, how hard that hits, okay? You can also hear that I can speed it up and down. Now there's a few different transmitter heads that we have for musculoskeletal care. You can see there's ones for larger body parts that have different metal alloys, and all of these, some have softer ends. For instance, if we're working on a hand or a face, we use something, even though it sounds like a jackhammer, that can be really comfortable for the patient. And each of these have different depths of penetration and different waves that help to produce a different result, or to work on a different tissue, or to help gauge how much pressure is going into the patient to help them tolerate it and make it comfortable. Okay, so now that we've talked about shockwave therapy, let's talk a little bit about plantar fasciitis. So plantar fasciitis is an irritation, inflammation, or injury of the covering of the bottom of the foot. That covering of the bottom of the foot we call fascia. Since it's on the bottom, think plantar wart, we call it plantar fascia. Now that plantar fascia comes from the ball of the foot, or what we call the metatarsal heads, converges into a more narrow band through the middle part of the foot, and then inserts into the heel bone or the calcaneus, more on this inside edge. Okay? So an easy way to test if you have plantar fasciitis is to take your thumb on the inside and press in this way. If you feel an irritation in there, chances are your plantar fascia is pulling harder than it should against this, and you'll have pain. If you have a lot of pain there, you probably have plantar fasciitis. But of course, always good to check with a qualified practitioner, not self-diagnose. Some patients also notice straight down on the heel bone here, they'll have pain as well. Now there's a little fat pad here that gives us some shock absorption that can also break down, and that can be a different condition. So plantar fasciitis, if you looked in the textbook, usually presents like this. Somebody gets out of bed in the morning and their first 2 or 3 steps are really painful. A sharp, jabbing, needle-like or shock-like pain into this area of the foot. Another textbook presentation is somebody that after a long day comes home, sits in the easy chair for a half hour, hour, 2 hours, then gets up suddenly to go to the refrigerator or something and feels that sharp pain. So this tissue gets dense and then it pulls against the insertions. Now, it isn't always pain at the heel, although that's most typical. We can also have pain through the middle or up here at the origin as well. So what we're going to do with the shockwave therapy is send these shock waves all along to stimulate healing, repair, stem cell activity, and a number of other wonderful things, including blood flow, to that area. So let's show you how it works. So I'm going to set the unit here so it's comfortable. use some conductance gel. And we're going to get started. So we turn on. We're going to start right here at the origin of the fascia. You can see my conductance gel. And I'm going to just put nice light contact from the instrument into her foot. We're not jabbing in and pushing real hard, but I am making sure that I can feel those tissues in there and help to localize if I feel an area that's more dense than others. So we'll follow that all the way, also going into that insertion, all the way around, up and down. This handpiece is nice because I can also hold here and control that shockwave delivery through the front part of the handle. Now you may notice that there's a counter on here, and that counter will count up until we get to 2,000, 4,000, 6,000 pulses, and every 2,000 pulses it turns off to let us know how much of the treatment has been delivered. So a normal treatment, we're going to do somewhere between 2,000 and 6,000 pulses, depending on the need of the patient and what they can tolerate. So this shows a seated supine or face-up approach to working on the plantar fascia. And we're going to show you also what it would look like with the patient prone or face down. So we'll just clean a little of that off so it's easy for you to flip over. Okay, in a similar way, we put some more conductance gel on. We're going to add a little up here for her as well. And we work again. So say I wanted to decrease the speed, but increase the intensity slightly. We can now glide and work all the way up that plantar fascia into the insertion, even right into that calcaneus. I'm going to bring a little more of the gel around here. Same thing with the outside of the foot. Now what a patient might tell you is when we get to more shallow tissue or bony surfaces, it might be a little more achy or a little more intense. So in those cases we can change really very easily with this machine and this handpiece how much we're delivering in there. Now with plantar fasciitis, we're not just exclusively only treating the bottom of our foot, but the majority of sessions will be worked around that. We also want to work on the tissues that connect and attach coming down through the calf and through the Achilles. So similarly, we're going to find an intensity that's comfortable, but also effective and release. We could work clear up into the belly of the muscles here, and work through the musculotendinous junction, even clear down into and through the Achilles. Which would make a great difference as well into the plantar fascia themselves. One big mistake I see is some practitioners and therapists only working in the site of pain and not looking at adjacent areas that could be contributing. By the way, Shockwave Therapy works great for Achilles issues. One of the things we treat most often is Achilles tendinosis or tendinitis or even musculotendinous issues in the Achilles, so it works great for that as well, but that's a whole different video. So to review, Shockwave Therapy for plantar fasciitis using the Storz D-Actor Swiss-made machine. This is the top of the line unit in the world. We're working for plantar fasciitis, working all the way through the attachments of the plantar fascia from the ball of the foot clear into the calcaneus and through the entire foot tripod. Okay. Also, not forgetting treatment up in and around the areas that connect to the plantar fascia. So if you have any questions or comments, please leave them. We love to respond to those. And if you have any more videos that you want to see, give us some recommendations. But again, this video, Shockwave Therapy for Plantar Fasciitis. I'm Dr. Jon Wilhelm with Pro Chiropractic in Bozeman, Montana.